Hello everyone. So in this video, we will be discussing about 5 clinical questions from anatomy. So clinical questions are really important to understand the practical side of anatomy, and they give us a confidence to attend long and lengthy questions. So let's get started. First, here is the scenario 1. Your 17-year-old neighbor comes over on a Saturday morning complaining of rib pain after last night's football game. If chest X-ray indicates a right rib fracture, where is the rib most likely to be broken? What is the differential diagnosis if chest X-ray has revealed nothing and he has a bump right around his sternum? Now, the first thing here to do is we must observe the key words, right? So, 17-year-old neighbor, he played football and then he has rib pain. And the chest X-ray shows that there is a right rib fracture. Now, the first question here is, where is the rib most likely to be broken? Okay, now the answer for that is the angle of the rib. The angle of the rib is the most easily breakable part. So look here, just anterior to the angle of the rib. This is the weakest part of the rib. Now, to answer the second question, which is the differential diagnosis, if there is a bump around the sternum, he may have dislocated a rib from the interchondral joint. So interchondral joint is the joint between the sternum and the costal cartilage, sternochondral joint. Or he may have separated the rib from the costal cartilage. So dislocating the rib from the interchondral joint or separating the rib from the costal cartilage joint can cause a bump around the sternum, and that is why he had a bump. That is a differential diagnosis. And remember, the weakest part of the rib is the angle of the rib. Here you can see the angle of the rib pointed, which is broken. Now, moving on to the scenario 2. A 24-year-old female comes to the ER after a car accident complaining of chest pain and dyspnea. After you expose the chest, you notice a segment of a chest that moves inward on inspiration and outward on expiration. What is causing this paradoxical movement of her chest while breathing? Now, first, let's understand the keywords here. Car accident, chest pain, and dyspnea. Chest pain is there, and dyspnea means shortness of breath. And after you expose the chest of the patient, you notice that the segment of her chest is moving inwards on inspiration. So that means when she breathes in, the chest goes in. And when she's breathing out, the chest goes out. That is not used to happen, right? In the normal circumstances, when you breathe in, your chest raises and your chest comes out, outward. But here it's the opposite case. So here, since she was involved in a car accident, the most likely thing that could have happened is multiple rib fractures, and because of that, she might have flail chest. So see, flail chest. At least 3 ribs have broken so that the segment goes inward when the chest cavity has negative pressure and outward when the chest cavity has positive pressure. Now take a look at this diagram here. So when the patient has multiple rib fractures, there is a flail segment formed here. Now, when the person inspires, what happens? There is negative pressure inside the chest. So when there is negative pressure inside, there is positive pressure outside. That means the pressure will push the segment inside, right? So that means when the person inspires, the segment will go in. And exactly the same thing apply for expiration. When the person expires, the negative pressure will be outside, positive pressure will be inside. So that means pressure will push the segment outside. So that is about flail chest. Now you can see the schematic or illustration diagram of flail chest, how the chest piece, the segment goes inside on inspiration and outside on expiration. And importantly, remember, flail chest happens when there are multiple rib fractures. Now, here you can see another diagram where you have multiple rib fractures which could potentially cause flail chest. Where I'm pointing my cursor now is the part where you can see rib fractures. Okay, now let's go to the scenario 3. While pulling out your wisdom teeth, the dentist drops one down your throat. If you aspirated this tooth, where would it most likely be found? Okay, so now you're going to a dentist and he's pulling out your wisdom teeth, and by mistake he drops it down your throat. They are asking where would it go? What are the chances and where would it go? So take the respiratory tract, okay? So the respiratory tract starts from the trachea and it divides into the right and left bronchus. Now we have to be specific whether the tooth is going to the right bronchus or left bronchus. So I can tell you that the tooth has a higher chance of going to the right bronchus. Let me tell you why. See, the right bronchus is more vertical in appearance than the left bronchus. Left bronchus is more transverse than right. This is not the exact anatomy of the lung, but when you look at the exact anatomy, the right bronchus is along the straight line more compared to the left bronchus. That means the tooth, when it is falling down, there is a higher chance that it can go through the right bronchus, right? Because the left bronchus is more transverse and horizontal. Now, that is the reason why, when aspirated, the wisdom teeth can be found in the right bronchus. Now, scenario 4. A patient with a history of blood clots come to your clinic claiming they felt a clot in their stomach dislodge. Though rare, you confirm there's a clot in her azygos vein. The surgeon takes out the clot, and less than a day later, she comes to the emergency department complaining of shortness of breath and has decreased lung sounds with dullness when percussing the lungs. What is causing her symptoms? Now, let's again note the keywords here. First, blood clot in the azygos vein. The surgeon is taking out the clot from the azygos vein, and then later she is feeling complaining of shortness of breath and there is decreased lung sounds. So when there is decreased lung sounds, the lung should be filled with some sort of fluid, right? And now compare it to the azygos vein. Now we have to decide whether it's blood, it's hemothorax, or pleural effusion, or chylothorax. Now, what is the closest structure to the azygos vein? An important structure that passes close to the azygos vein is the thoracic duct. So there is a high chance that the surgeon would have nicked the thoracic duct, due to which the lymph contents of the thoracic duct escaped into the lungs, causing chylothorax, and because of that, lung sounds were dull. Yeah. So the surgeon likely nicked the thoracic duct when working around the azygos vein and caused the chylothorax in this patient. Now I'll point you out to the thoracic duct. Sorry, the azygos vein first is shown with this arrow, and then the thoracic duct is shown. See how close in relation they are. Yeah, now to the final scenario of this video. A 50-year-old female starts choking on a peanut in the cabin of an airplane. At first, she is vigorously coughing, but then the coughing stops and she still feels very short of breath. Where was the peanut at when she was coughing vigorously? So here, let's note the key points again. She's coughing, okay? And the peanut is going inside her respiratory tract, which can cause choking. Now they're asking where was the peanut at when she was coughing. So to be specific, we know that the vagus nerve, when irritated, can cause cough and hiccups, right? So let's look at a position in the respiratory tract where the vagus nerve is more superficial, so that it can be easily irritated by a peanut getting stuck. So that point would be the carina. The carina is at the division of the left main bronchus and the right main bronchus. So this star, which you can see, is the carina. It is extremely sensitive because it is innervated by your vagus nerve. And if the peanut is getting stuck here, and because of irritation of vagus nerve, the patient will have cough. Now, with the final scenario here, scenario 6. A woman aged 72 meets a neurologist for consultation. The neurologist takes out a pen and holds it in front of the patient. Now he asks the patient to touch the pen with her fingers. As the patient extended her arm and came to touch it, she went past the pen instead of touching the pen. She was not able to touch the pen even after repeated attempts. Now, what is the problem here? Again, keywords. The age of the patient, 72. Now, the doctor is asking the patient to touch the pen, but she's going beyond it. So here, let's remember the motor activities are fine, but she's not able to control her motor activities beyond the point, right? So to control and plan out the motor activities, we need a part of the brain called cerebellum. So in this patient, there is absence of cerebellum, which is leading to the phenomenon called past pointing. So in this GIF, you can see the patient is clearly doing it properly. She's not past pointing. But when there is our patient, which we discussed in the scenario, the patient will not be able to do this properly. She'll go beyond the finger of the physician. Yes, done with the 6 scenarios of this video. I hope it really helped. We will come out with more scenarios so that you can practice and remain top at the knowledge of your clinical science. Thank you.